morning, everyone. Thank you very much for joining us this evening. I would like to thank and acknowledge our partners that are here today. Dr. Lisa Pickett, who is the Chief Medical Officer at Duke University Hospital. We have Gail Harris of the Durham Local Health Department, Janet Clayton of the Person County Local Health Department, Director Mike Sprayberry and his emergency management team. In addition, Governor McCrory has been fully briefed, and I am in regular communication with him about the following situation. In fact, I just left a meeting with him in his office here at the Emergency Management Control Center. Governor McCrory has also corresponded already with Governor Chris Christie this evening, and has also had discussions with the New Jersey Health Director. The McCrory administration has been actively working since July for the possibility that a patient in North Carolina might be diagnosed with Ebola. We have spent countless hours over this time period preparing with our federal partners and our sister agencies and our county partners. Today, this intensive preparation is being put to use as we closely monitor a traveler from Liberia. Earlier today, the Centers for Disease Control and Prevention notified our Division of Public Health that an individual arrived in North Carolina yesterday and developed a fever this morning. The individual was transferred this evening to Duke University Hospital in Durham, which is prepared and equipped for the evaluation, the isolation, and the treatment of Ebola patients. It is important to note that the individual's fever could indicate other illnesses. We do not know the reason for the individual's fever. Again, we have not confirmed that this is a case of Ebola. The patient will remain in a contained, isolated, and secured unit until the results of the Ebola test are known. The blood sample will be sent to our state lab of public health for preliminary testing, and we expect that the preliminary results of this Ebola test will be completed tomorrow morning. In addition, at this time, our public health officials believe that the risk of exposure to others is extremely low. We are committed to an open line of communication and will share information with the public and as more information becomes available. Our preparations have been led by Dr. Megan Davis, our state epidemiologist and chief of the epidemiology section of the department's Division of Public Health. I'm very proud of the quality of the work that she has done to prepare our state, and she has led these efforts to monitor this specific patient. Dr. Davies completed her medical training at the University of North Carolina at Chapel Hill and her residency in family medicine in East Carolina University. She received her epidemiology training at the Federal Centers for Disease Control and Prevention in the CDC's Epidemic Intelligence Service. Following her training, she worked as an epidemiologist at the CDC, where she responded to the anthrax attacks. She has worked in the department's Division of Public Health since 2002 and assisted with the state's response to the SARS pandemic and deployed by the CDC to the Astrodome following Hurricane Katrina and led the response to the H1N1 pandemic. As chief of the epidemiology section, Dr. Davies oversees the surveillance the outbreak response, and the programmatic activities for communicable disease, occupational and environmental health, and our public health preparedness. At this time, I would like to turn it over to Dr. Davies to provide us additional information. Dr. Davies.
Thank you, Madam Secretary Walsh, for your support and leadership in our work to prepare North Carolina for any possible Ebola cases. This morning we received a call from the Centers for Disease Control about a traveler to North Carolina who developed a fever this morning. The traveler arrived in North Carolina yesterday morning and went directly to his family's home. The traveler was monitoring temperature as instructed when coming through Customs and Border Patrol, and upon detecting a fever this morning, called the CDC line, and they immediately called the Division of Public Health. We contacted the Person County Health Department and have been working in collaboration with Person County Health Department to interview family members and the patient. We contacted Duke University Medical Center, who agreed to receive the patient for evaluation, and the patient was transported via a prepared EMS unit with properly prepared EMS staff in appropriate personal protective equipment, safely to Duke University Medical Center, and directly taken to the isolation unit that they have ready for evaluation of any potential Ebola cases. The patient at this time has a fever and does not have any other symptoms characteristic of Ebola. And the patient is being evaluated by physicians at Duke. A blood test will be performed at the North Carolina State Laboratory of Public Health, part of the Department of Health and Human Services here. And this will be the first of possibly a pair of blood tests done. The first test will be done during the night tonight. We hope to have results in the morning. If that test is negative, the patient will continue in isolation at Duke until 72 hours after the initial presentation of symptoms, when the test would be repeated to confirm negativity. And that's the protocol we anticipate following at this time. We will share results of the test as we have it in the morning. Madam Secretary?
I would also like to thank our partners and our partners at Duke University and our partners in Person County, both in the local Department of Public Health as well as with the Sheriff's Office. And at this time, we can take a few questions if there are any.
How did this person travel to North Carolina? Did they fly through or drive?
The person arrived at the Newark airport and then took a bus to North Carolina.
Was it a bus to Person County specifically?
There was a bus to Durham County, and then a family member drove the individual home in Person County.
Was it a charter bus or a Greyhound or?
It was a commercial bus.
What's now the step for notifying people on the bus, other people who may have been in contact with this person?
So keep in mind, this person did not have symptoms when traveling on the bus, and you do not transmit Ebola when you're asymptomatic. Also keep in mind that this person has not been diagnosed with any specific condition yet. So we are working with the CDC on identifying more about passengers who may have been on that bus, but our priority right now is on evaluating the patient and testing.
Dr. Voss, we have time for one more question. This is it.
Okay, question. Well, go ahead.
Did this person travel to Liberia, or are they from here specifically? They were there temporarily?
The person traveled from Liberia to here.
But they
Tell us
live
your
here?
name.
All right, thank you very much, Dr. Davis. We've got to go. We have a scheduled meeting. Thank you, gentlemen, ladies and gentlemen.